Hey guys, welcome back to my channel. This is gonna be a video about bottom surgery. So I'm gonna be using like anatomical terms. So if you don't want to hear that, please click off now. Alright, so bottom surgery. So there's two procedures. One is the Metoidioplasty, which a lot of people call that like meta. That's one that uses your own anatomy and there's less complications. And then there's Phalloplasty, that's the more complicated, where they actually make a phallus. So I'll go through meta first. So for meta, there's a lot of different ways you can do it. First, you can have urethral lengthening. So pretty much they try to make a urethra. This is gonna be dependent on how big like your T-dick is to be able to stand a pee. Oftentimes they say it's unlikely. So if that's like your #1 priority, then they would suggest phalloplasty. You can also get a vaginectomy or not, so that's just the closing of the vaginal canal. You can opt for a scrotum, which they make it from your labia minora and majora, that kind of area, that skin. Then you can put like testicular implants in there or not. And then if you want to kind of know like in depth of actually what they do, you can Google the procedure. I'm not going to go through it now. So essentially with that one is you'll have like a micro penis, and penetration is not going to be much, if not at all. So a lot of surgeons will kind of go through what you want. And a little note on this, that if your insurance covers, let's say you want meta, you get it and then you don't like the results, they're unlikely to cover the second surgery to get phalloplasty. So a lot of surgeons just make sure that you know the downfalls of meta, that you're not going to have a functional standardized penis, if that makes sense. So the second surgery, the most common is phalloplasty. So that's where they actually make a phallus, and you can either get, the two popular procedures are RFF, which is the radial forearm flap. That's the most common. And then there's ALT, which they take it from the thigh, the donor site. There's also like a new abdomen one that you can get. I've heard you can get like your donor site from your back, but those two are the most common. The RFF is what I plan on getting. It's the most popular, the most, I would say if you're concerned about function and looks and sensation, RFF is definitely the way to go. Because with ALT, you'll usually get like a thicker phallus, so it will be girthier just because of the thigh region. But also with RFF, you're going to have a scar on your forearm, whereas ALT, you're going to have a scar on your thigh. RFF, you will have a scar on your thigh to cover the skin, but ALT, there's no scars on your arms. So some people just like that better. I'm looking for functionality and looks. I want it to look as most normal as possible. So what they do is they take the skin, the tissue, the nerves, and the arteries from your forearm. It's usually done in 3 stages. This is going to vary by surgeons. The one that I'm going to, they do it in 3 stages. The first stage is just the creation of the phallus and the attachment down below. The second stage will be their urethral hookup. So they will make their urethra, they just won't hook it up. And it'll be the vaginectomy, which again is just the closure of the vaginal canal. And then they'll do the scrotoplasty. So again, they use that labia minora majora area for the scrotum. And the stage 3 is the erection device and testicular implants. Of course, all of this is dependent on your needs. Some people don't even do all these stages. It just depends on what you want. Everything's customizable. I pretty much want everything, you know, a fully functioning penis with everything. The most common complications are urethral strictures, so that's the narrowing of the urethral canal, and then also fissures, so that's actually holes in the urethra, so your urine goes out everywhere. So those are the most common. Again, you can, all these vaginectomy, scrotoplasty, testicular implants, erection device, these are all by your choice. I will say most surgeons though, if you want the urethral lengthening, you have to get the vaginectomy. It's just kind of part of it. And so a couple of the prep work for phalloplasty is you have to get electrolysis on your arm or on your leg, depending on which one you go for. That could take anywhere from 6 to 12 months. You also, if you're getting the vaginectomy, no matter what procedure you're getting, you have to get a hysterectomy. You don't have to get a complete one. So they just require the uterus and cervix to be taken out, just because without the vaginal canal, you can't actually check for cancers and like screenings and stuff. So you can keep your ovaries just as by choice. And actually, most insurances actually cover bottom surgery now. So you need to be on the lookout for that. It is a long recovery, especially phalloplasty, and with phalloplasty it will take over a year to complete because each stage requires a certain amount of time, and then also any complications, it just extends that. So just be aware. And the first stage is usually the longest and hardest. I have heard some of the surgeons do like a combined stage 1 and stage 2. It's a lot for the body to recover from, and like I said, most of the time it will depend on what surgeon you go to on how they stage it, but usually always the erection device and testicular implants is definitely a separate thing. So yeah, this was just kind of a brief overview. The next few videos I'm going to be going through the hysterectomy process, so kind of the same thing like I did with top surgery, like the insurance and how to get them to cover it, the consult, because my consult for the histo is the end of this month, the end of March, and then my consult for phalloplasty is September. So everything's coming up pretty quickly. I'm doing all the prep work now. Once I have my consult with my surgeon for phalloplasty, I can then start electrolysis, because with this surgeon I'll be having surgery about a year after my consult, which is super quick. A lot of surgeons, you're like waiting at least a year to 3 years just to get the consult, and then another year, 2-3 years. So a lot of the time, you know, you're waiting years and years. That's what I expected. My wait time total will be about a year and a half, which is crazy. That's pretty quick. I'm not sure exactly how I was able to pull that off, but I did. And the surgeon that I picked is, if you guys want to know, is Dr. Devin Kuhn. He is now in Boston at the Mass General, specifically the Brigham and Women's Hospital. He was at Johns Hopkins as a surgeon there in Maryland. He's very well known. You can look up his results. That's pretty much what I did. I looked at all the New England doctors, looked at all their results, and went from there. I also I was looking into like out of state, like with Dr. Chen, Dr. Crane, stuff like that, but due to insurance purposes, I wasn't able to go that far out of state, because those are great surgeons as well. And I think Dr. Chen is one of the ones that does the less stages too as well.